They enrolled people with an alcohol use disorder into their clinical trial, and they randomly assigned them to a group that got a low dose of Ozempic over a period of 9 weeks or a group that got a placebo medication. They tested drinking behavior in a simulated drinking environment. So before they started treatment with Ozempic or the placebo, and 9 weeks later, they would come into a laboratory setting. It was made to look like a living room. They had a bar fully stocked with their favorite alcoholic beverages, and they were instructed that they could drink as much as they wanted to. And then the amount that they drank and their blood alcohol levels were measured before and after they finished that 2-hour session. What they found was that at the end of the 9 weeks, individuals who got Ozempic drank significantly less than the individuals who had the placebo. Now, then as a secondary question, they evaluated how much were they drinking out in the real world in their natural life. And this is where the results are a little bit mixed. On average, per calendar day, they didn't change their drinking outside of the laboratory setting in a significant way. They also did not drink on any fewer days out of the past month or months after having Ozempic every week than they did before. But when they did drink, they drank fewer drinks. So if they drank 3 times in a week, where they used to drink 7 drinks a day every time, maybe they were drinking 5 or 6. Although it didn't promote abstinence, it did promote a reduction in alcohol use. That's actually pretty well aligned with the direction that the field is going, where we are understanding more and more that abstinence as an only goal is not really the gold standard in our field anymore, because we are seeing that there are health benefits and health impacts of changing or reducing one's drinking. There are impacts on liver function, there are impacts on overall mental well-being and one's feeling of control over their alcohol use. Now, that's not for everyone. For someone with a severe addiction, controlling one's alcohol use may not be feasible in the longer term.